Media presentation project, I focused my project on the theme of mood disorders. In an effort to narrow my scope of focus, I chose to primarily concentrate on the concept topic of suicide. Beginning with mood disorders, most of us feel depressed from time to time. Failing an exam, getting into an argument with a friend, not being invited to a birthday party, getting rejected from your first choice college or job, and breaking up with a romantic partner are all examples of an event that can cause a depressed mood in many people. Mood disorders involve much more severe alterations in mood for much longer periods of time. Mood disorders are different in nature. All mood disorders, formerly called affective disorders, extremes of emotion or affect, soaring elation or deep depression, dominate the clinical picture. Other symptoms are also present, but abnormal mood is the defining feature. There are two key moods involved in mood disorders. They are depression, which usually involves feelings of extraordinary sadness and dejection, and mania, often characterized by intense and unrealistic feelings of excitement and euphoria. Some people who have mood disorders experience only time periods or episodes characterized by depressed moods. However, other people experience manic episodes at other time points. Normal mood states can occur between both types of episodes. Manic and depressive mood states are often conceived to be at opposite ends of a mood continuum, with normal mood in the middle. Sometimes an individual may have symptoms of mania and depression during the same period of time. In these mixed episode cases, the person experiences rapidly alternating moods such as sadness, euphoria, and irritability, all within the same episode of illness. Major mood disorders occur with alarming frequency, at least 15 to 20 times more frequently than schizophrenia, for example, and at most the same rate as all anxiety disorders taken together. Now to focus on my concept topic of suicide. Suicide is one of the leading causes of death worldwide. Nearly 10% of adults report that they have seriously considered suicide at some point in their life, and nearly 3% report have made a suicide attempt at some time. The rate of suicidal thoughts and behavior increases dramatically during the adolescent and young adult years, and psychological disorders such as mood and bipolar disorders are especially strong risk factors for these outcomes. The risk of suicide, intentionally taking one's own life, is a significant factor in all types of depression. Virtually all psychological disorders increase the risk of suicidal behavior. Indeed, approximately 90 to 95% of those who die by suicide have had a history of at least one psychological disorder. Suicide is currently the 15th most leading cause of death in the world, accounting for 1.4% of all deaths. By comparison, there are more deaths each year around the world by suicide than due to all wars, genocide, and interpersonal violence combined. Studies of survivors show that the loss of a loved one through suicide is one of the greatest burdens individuals and families may endure. Consider this example. Ernest Hemingway died by suicide on July 2, 1961. 35 years later to the day, his granddaughter Margot took her own life as well. The Hemingway family has endured 5 suicides over 4 generations. In virtually every country around the world in which suicidal behavior has been examined, women are significantly more likely than men to think about suicide and to make non-lethal suicide attempts. But men are 4 times more likely than women to die by suicide. This difference in likelihood of suicide death is explained in large by the fact that men tend to use more lethal means in their suicide attempts, example, firearms, than do women. Another pattern seen consistently around the world is the dramatic increase in suicidal thoughts and behaviors, including suicidal death that occur during childhood and young adulthood. Suicidal thoughts and behaviors increase in prevalence starting around age 12 and continue to increase into the early mid-20s. The rate of suicidal death follows a similar pattern, followed by a peaking in middle-aged 45 to 55 years old and a slight decrease and leveling off for the remainder of lifespan. One remarkable trend has been the increased risk among adolescents and young adults, which emerged during the past several decades. One obvious reason is that this is a period during which depression, anxiety, alcohol and drug use, and conduct disorder problems also show increasing prevalence, and these are all factors associated with increased risk for suicide. Increased availability of firearms has also probably played a role as well. Exposure to suicides, especially those of celebrities through the media, where they are often portrayed in dramatic terms, has probably also contributed to these increases in adolescent suicide, perhaps because adolescents are highly susceptible to suggestions and imitative behavior. Many college students also seem very vulnerable to the development of suicidal ideation and plans. The combined stresses of academic demands, social interaction problems, and career choices, perhaps interacting with challenges to their basic values, evidently make it impossible for some students to continue making the adjustments for their life situations demand. The most widely studied risk factors for suicidal behaviors are the presence of different psychological disorders. As noted prior, the presence of virtually all disorders increases the risk of subsequent suicidal behavior, and most people who die by suicide have a prior mental disorder. Different disorders are associated with different parts of the pathway to suicide. Depression is the disorder most strongly predictive of which people develop suicidal thoughts. However, it does not predict which people with suicidal thoughts go on to act on them and make suicide attempts. Instead, it is disorders characterized by agitation, aggression, impulsiveness that predict acting on one's suicidal thoughts, such as post-traumatic stress disorder, bipolar disorder, conduct disorder, and intermittent explosive disorder that predicts this transition. The fact that different disorders predict different parts of the pathway to suicidal behavior may help to explain the dose-response relation that is consistently observed between the number of disorders present and the risk of suicidal behavior. People who become suicidal often come from backgrounds in which there was some combination of a good deal of family psychopathology, child maltreatment, and family instability.